Good morning, Virginia. This is Virginia This Morning with Julie Bragg and Greg McQuaid.
Have you ever wanted to ask your doctor a medical question after business hours? If you dream of 24/7 access to your doctor, that dream is a reality due to a growing trend in Richmond.
Well, it's actually called concierge medicine and thought of as a lot of perks. Comes with a hefty price tag, though. Dr. David Wu-Pong from PartnerMD tells us more about concierge medicine. Doctor, great to see you. Thanks for coming in.
Good to see you.
Thank you very much
I guess
for having me.
everything is on demand these days, and now doctors are as well. 24-hour service called concierge. Tell us about it.
Well, concierge medicine is it's a different kind of practice style compared to traditional practice. I think many of us have gotten a bit frustrated with both on the patient side and the doctor side with how traditional practice goes. You often have to wait for long periods of time. We're getting shorter and shorter times with our physicians. We take the doctor-patient relationship and really honor and respect that. We find it's the most important thing in terms of helping our patients stay healthier, in terms of helping them solve their medical problems. And so to do that, we limit our number of patients to a very small number. Currently at PartnerMD, we limit our physicians to 600 patients or less. In my former practice, I had about 5,000. And so it's a dramatic difference. And as a result, we can be much more available. We can have same-day or next-day appointments. We often offer 30-minute appointments for virtually any problem. It allows us to be very accessible by email or, as you were mentioning, by 24/7 access by cell phone. It allows that relationship to really form the core of what we do.
And there's no waiting room full of people waiting, because when you set these appointments, people show up and you're waiting for the patient shows up, and you go on and do your thing.
Yes, we typically have waiting times of less than 5 minutes. Again, it's part of respecting that relationship. We're saying we recognize that you're part of the partnership. It's not just the doctor's visit, it's a physician-patient relationship, and you bring information, you bring your concerns, we bring some expertise and some ways to help put what you need in the context of your care. And your care is different than Greg's care, and we try and make sure that we see those differences and work with that.
Doctors, does that change your approach to treating patients as well?
Yeah, it really does. I find that we're able to get to know our patients. It's kind of a funny way to say it. We spend more time in the individual visit, but it allows us to get to know our patients much better in a shorter period of time. So over a period of a year, for example, we do a physical exam that's 3 hours instead of where I worked before. We would only spend about 30 minutes. And when you add that together with the, let's say, couple of visits during the year, you'd come in for a half hour each time. You know, we're already spending 3 or 4 hours together face to face working on health problems, getting to know you. And that's a lot more time than most of us get to spend with our physician when we're spending, 5-minute visits.
It might be easier for the patient to ask you questions if they really know you a little bit better as well.
Well, that's certainly my belief. I feel that one of the hardest things to do is develop that trusting relationship, and yet it's one of the most important things, because otherwise, how can you trust the physician to tell them the stuff that really matters to you, the stuff that you're really worried about, the stuff you might feel silly asking about? And yet, again, I feel like, it sounds like you do, that having that trusting relationship, and that relationship where you really know they're going to be there for you, and it's not just an interchangeable thing. It's not that my partner will be there for you. They will, but it's that I'll be there for you almost every time you need us.
Now, an example would be a patient might pay, say, $1,500 to become a member, a partner.
Correct.
And in case folks are wondering if people in our area are doing that and think that this is a great idea, the practice has grown, your practice alone, from 1 doctor to how many in just 5 years? We
have 6 physicians now, and it's growing very quickly. Right now, we estimate at about 40 patients a month are joining our practice.
Wow.
It's an unfortunate thing. I think traditional practice has many limits, and I think that people, again, physicians and patients, are running into those limits every day. I wish that the traditional system didn't have those limits and that there wasn't a need for this sort of thing. By the same token, I love the fact that we have this kind of time to spend with our patients. I think it makes the care much more personal and much more specific to the needs of the people.
Well, Doctor, it's called concierge medicine, and we appreciate it. Dr. David Wu-Pong,
thank you.
Appreciate it.
Thank you
Good
very much.
Good morning, Virginia. This is Virginia This Morning with Julie Bragg and Greg McQuaid.